When I public speak, I have a tendency to use my hands and move a lot, so hopefully I'll use this mic as a chain to keep me from doing that too much. All right, let's go. So about 9 years ago, I woke up. I was in an extreme amount of pain. So much I could not get out of bed. My pain was right here on the front of my right hip. Once I dragged myself out of bed, I realized that every movement that I would make was even more painful. It hurt to walk. It hurt to take every step. If you've ever raise your hand if you've ever experienced significant pain before. So this might sound silly, yeah. This might sound silly, but you have to deal with the actual hurt of the pain, but you also have to deal with the fatigue and how taxing the pain is. And so I did drag myself to work that day, but for the next couple of weeks I had significant pain. And speaking of pain, and speaking of work, I was almost embarrassed to be at work. And I know you guys know that I'm a chiropractor, but can you think about that, right? I'm in obvious pain, I'm limping around, I'm supposed to be the answer for pain, right? So I'm anxious, I'm worried, what are my patients thinking of me, right? So I had that stress on top of the actual pain. And then the last aspect for me specifically, I'm an extremely active person. I'm in the gym a couple times a week, I swim a couple of times a week, I still to this day play softball and flag football. So now I'm not able to do these things. I do yoga, I do Pilates. I'm not able to do these things. So all of these things are affecting me significantly, professionally, personally. Well, this event that happened and what I would learn during this event would set me off professionally on a trajectory that I never thought would happen, and it wouldn't have happened unless I experienced this. So what I came to realize over the next couple of days, through going to visit doctors and some self-diagnosis, of course I did some of that. First of all, I knew it wasn't an internal emergency type pain. I knew it was musculoskeletal. But what I was diagnosed with was a sports hernia. And in my specific sports hernia case, what it was damage to the muscles of the hip and the groin, and even the core a little bit. So surgery was certainly on the table. But for me, I had been a chiropractor for only 1 year at this point. So building my practice, I've got no time to take off to go through the rehab and the surgery. And it finally dawned on me, as I was going through chiro school, one of my classmates was not only going through school like the rest of us, but he was also studying this soft tissue technique. It's called active release technique. So I reached out to him, I said, hey, I can't do this surgery right now. What can I do? He said, try this. Find somebody in your city, find a doctor in your city that does this, reach out to him and see if he can help. Well, over the next couple of weeks, that's exactly what happened. I reached out to a doctor who was gracious enough to treat me. And over about 7 or 8 treatments, my pain got better and better and finally went away. I can tell you right now, I'm just as active, if not more active than I've ever been, and I haven't had that pain since. So what happened? What did that experience teach me? It taught me 2 things. Number 1, if it could help a sports hernia, what else can it help? But number 2, and more importantly, what it taught me was I needed to be certified in this technique. So I took the next 2 years, I traveled across the country, I went to seminars, I studied, I got certified level by level until I'm now full body certified in active release. And now it's almost exclusively what I do in my practice. As my training went through, I learned all soft tissue injuries, unless it's an extreme surgical case, all soft tissue injuries are very similar. There's inflammation, there's potentially scar tissue, sometimes there's micro tearing. And what active release was doing, it was identifying which tissues were involved, but it was manually manipulating them to remove the inflammation and to expedite the healing. So what happens? You take the pressure off the tissues, you take the pressure off the joints, and your symptoms start to resolve. So that's what I learned. And as I said now, this event, I would never have been where I am now. I exclusively, like I said, do active release with my patients. It's not your traditional form of chiropractic, now is it? Most of you maybe have never heard of it. Most of you thought, this guy probably just cracks backs all day. And the neat thing is I get to treat all over the body. Sprains, strains, shin splints. I have a ton of runners as patients. Runner's knee, plantar fasciitis. Anybody ever heard of that painful condition? That's the number 1 thing that I treat in my office. So that whole experience taught me, it brought me to where I am today. I'm very grateful for it. But we've had an opportunity to have a positive impact on so many patients throughout the years since I've been certified. So that's my little story about chiropractic and the specialty that I have within the field. I'm certainly happy to answer questions. I will be available at the end. And thank you guys for listening.